No problem.
Hello. Thank you for asking me to speak. I am Dr. Catherine Guthrie, leader with Isaiah Faith in Minnesota, and also a family physician who has practiced in Minnesota for 43 years. I've spent the first part of my career in 2 rural communities, very small communities, and for the last 29 years have been working with a safety net clinic in downtown St. Paul who both provides access to care and trains young family physicians. I've seen firsthand many examples of the consequences of under or uninsurance and strongly support access to MinnesotaCare increased through the public buy-in option. The following 3 stories are real examples of the high cost of un or underinsurance. People whose lives would have been radically changed had they had access to the type of care option in the proposed bill. First, a 40-year-old man found a lump in his testicle. He couldn't afford insurance, although he was employed, because he made more than the $27,000 a year, which is the threshold for MinnesotaCare buy-in currently. Because of fearing the bills, he delayed presenting to one of my partners to seek care. By the time he was able to get diagnosed with testicular cancer, it had spread all over his body. And despite efforts with expensive and then unsuccessful treatment, he died in his early 40s. A mother in her late 30s found a breast lump. Because she was undocumented, she delayed getting it checked. While a state screening program covered the cost of diagnosis of her breast cancer and emergency assistance covered her initial surgery, she had no coverage and could not access any coverage for the long-term follow-up needed to manage a chronic illness like breast cancer. When she returned to care, her breast cancer had spread to her bones. They can create a stalemate for her cancer, but she has young children at home, and she will likely not survive. A self-employed friend was only able to get insurance with a very high deductible that she couldn't afford. She delayed testing for life-threatening sleep apnea until she developed heart failure. On behalf of the 1,000 Minnesotans who have similar stories, I urge you to pass this bill to expand the public buy-in option, including people who earn above the 200% federal poverty income guidelines, those who otherwise face unaffordable copays, and undocumented persons who contribute immensely to our state economy. No Minnesotan should have to pay for lack of affordable health care with their life or with their family's well-being. I firmly believe that passage of this bill is a step toward broader justice in health opportunities for all Minnesotans. We can and will do better. Thank you.
Well, it's just such an honor to be here today with the advocates who have worked so hard and are bravely sharing their story. You've just heard from these advocates in clear and sometimes very heartbreaking terms why the MinnesotaCare public option is needed. I'm really grateful, especially to Tavana. We're all so sorry for your loss. All Minnesotans deserve access to quality, affordable care. This is, somebody asked, why do you seem so happy this year, right? This trifecta gives us the power to change people's lives, to dramatically impact people's lives, from restoring the vote to driver's licenses for all. But this perhaps is the most clear example of where public policy can intervene and make a meaningful difference in people's lives. We have the opportunity to provide this MinnesotaCare public option. And in the current legislature, we are working to make this a reality. It really is a matter of life and death. And beyond it being a matter of life and death, it's about the quality of life that Minnesotans experience. A public option will give Minnesotans across the board the option to pursue high quality care. It will build on this proven model that was a wonderful breakthrough in 1992 of Democrats and Republicans working together, and will be able to provide that health care at a price that people can afford. For more than 30 years, MinnesotaCare has been making a difference in people's lives, and we know we can now expand that to more people. A broad group of stakeholders has been working to create this MinnesotaCare public option since 2016, and here we are in 2023, and we can make it happen. We absolutely need to make sure that every Minnesotan can afford their health insurance premiums and actually get the care that they need. Thousands struggle with insurance that they cannot afford, either because of high deductibles or high copays or all the other expenses that you've heard about that go with getting health care for a loved one. But this doesn't need to be the case in Minnesota. We don't need to be dependent on employer provided, large employer provided healthcare plans. We can provide another option. So many Minnesotans right now who have employer-based healthcare don't change their job and they don't start small businesses because they're concerned about losing their healthcare. And we have inexcusable racial disparities in Minnesota in so many different ways, and access to healthcare is one of the areas where we have inexcusable racial disparities. So with the MinnesotaCare public option, we can really do something about the disparities that we currently have in care for Minnesotans. I want to thank the majority leader for his courage to step up and carry this bill. The governor just signed his 100% clean energy bill into law yesterday, and I said he better get used to having the governor sign his bills into law. This is going to be a lot of work to get through the whole system and bring it to the governor's desk, but I think we know we've got a capable ball carrier here who can bring this into the end zone. So thank you for everyone who has worked so hard so far. This is government of the people, by the people, for the people, only when the people are part of the enterprise here at the state capitol. And so I want to thank you for doing your part to bring this proposal to the legislature. And now we'll do our part and we'll get it passed. And with that, I think we'll take questions.